Hello nurses, how are you all, and welcome back to my channel Nurse Navigator Swati. I'm back with the second part of Mental Health Nursing MCQ question and answers. Quickly go through my part 1, review your knowledge and do subscribe for more such MCQs. Let's get started. Question number 1. Haloperidol 5 mg TID is ordered for a client with schizophrenia. 2 days later, the client complains of tight jaws and a stiff neck. The nurse should recognize that these complaints are: options are common side effects of antipsychotic medications that diminish over time. Option 2, early symptoms of extrapyramidal reaction to the medication. Option 3, psychosomatic complaints resulting from delusion system. Or option 4, none of the above. When a patient is getting haloperidol and having a complaint of tight jaws and a stiff neck, the nurse should recognize that these complaints are the early symptoms of extrapyramidal reaction to the medication. Option 2 is the correct answer. Question number 2. Group therapy can best help those who: option 1, are emotionally ill. Option 2, are dependent on others. Option 3, feel they have a problem. Or option 4, have no one to listen to them. Yes, group therapy can be best help to those who have no one to listen to them. Option 4 is the correct answer. Question number 3. Abrupt withdrawal of barbiturate use could cause a person to experience. Options are ataxia, urticaria, diarrhea or seizures. If there is a abrupt withdrawal of barbiturate use, then definitely a person will experience seizures. So option 4 is the correct answer. Question number 4. When a client makes up stories to fill in the blank spaces of memory, it is known as lying, denying, confabulating, or option 4, rationalizing. Yes, you are absolutely right. When a person makes up stories to fill the blank spaces of memory, it is called confabulating. Option 3 is the correct answer. Next question. Delusion is a disorder of thought, perception, insight, or option 4, cognition. Delusion, that means a false fixed belief, is a disorder of thought. Option 1 is the correct answer. Question number 6. The following is not an atypical antipsychotics. Options are clozapine, olanzapine, thioridazine, or option 4, risperidone. Clozapine, olanzapine and risperidone all are the atypical antipsychotic, but thioridazine is a typical antipsychotic drug. So option 3 is the correct answer. Question number 7. The nurse understood that the medication therapy for Parkinson's disease is: options are it is a curative that cures the disorder. Option 2, it is a palliative that means manages the symptoms only. Or option 3, producing unwanted side effect. Or option 4, administered for 2 to 4 weeks only. For a patient with Parkinson's disease, the nurse understood that the medication therapy is a palliative therapy which manages the symptoms only, not the curative one. So option 2 is the correct answer. Next question. The primary clinical manifestations of Parkinson's disease include the following, apart from: option 1, pill rolling tremors. Option 2, slowed retarded movement. Option 3, muscular rigidity. Or option 4, loss of intellectual capacity. Pill rolling tremors, slowed retarded movement, muscular rigidity, all will be the primary clinical manifestations of Parkinson's disease, but loss of intellectual capacity is not a primary clinical manifestations of Parkinson's disease. So option 4 is the correct answer. Question number 9. Which of the following neurotransmitter is decreased in Parkinson's disease? Options are dopamine, serotonin, adrenaline, or epinephrine. Yes, you are absolutely right. Dopamine is decreased in Parkinson's disease. Option 1 is the correct answer. Question number 10. A client with obsessive compulsive behavior is admitted in the psychiatric unit. The nurse taking care of the client knows that the primary treatment goal is to: options are provide distraction. Option 2, support but limit the behavior. Option 3, prohibit the behavior. Or option 4, point out the behavior. While taking care of obsessive compulsive behavior, a nurse must know that the primary treatment goal is to support but limit the behavior. So here option 2 is the correct answer. Question number 11. The part of the mind that distinguishes right from the wrong and act as a censor of behavior is called: options are ego, id, libido, or option 4, superego. Yes, superego is that part of mind which distinguishes right from wrong and acts as a sensor of our behavior. Option 4 is the correct answer. Question number 12. A patient keeps repeating the last few words of what he hears. This condition is known as option 1 neologism, option 2 thought insertion, option 3 echopraxia, or option 4 echolalia. When a patient repeating the last few words what he hears, its condition is called echolalia. So option 4 is the correct answer. Question number 13. Which of the following behavior by a patient who has schizophrenia indicated impaired judgment? Option 1. Spending money on a new television instead of paying the electricity bill. Option 2. Staying up all night to care for a sick child. Option 3. Going outside in rain to help neighbors. Option 4. Leaving personal belongings behind when escaping from a house that has caught fire. Within these options, option 2, 3 and 4, all the 3 sentences indicated that the person is having a good judgmental ability. But the first sentence, that is spending money on a new television instead of paying the electricity bill, that indicated impaired judgment for that schizophrenic patient. So option 1 is the correct answer. Next question. A patient is newly admitted to a psychiatric unit with a diagnosis of bipolar disorder manic phase. Which of the following activities would the nurse do most appropriately for the patient? Option 1. Solving crossword puzzles. Option 2. Reading quietly in his or her room. Option 3. Playing a game of table tennis. Or option 4. Playing with modeling clay. When a patient is admitted with a diagnosis of bipolar disorder in manic phase, that time the patient will not sit in a single position. So solving a crossword puzzles or reading quietly in his room or playing with modeling clay, it is not the correct answer. The nurse should understand that playing a game of table tennis is the appropriate activity for the patient. So here option 3 is the correct answer. Question number 15. The nurse is talking with a client. The client abruptly says to the nurse, "The moon is full. Astronauts walk on the moon. Walking is a good healthy habit." The client behavior most likely indicates options are neologisms, dissociations, word salad, or option 4 flight of the ideas. For above mentioned 3 sentences, the client behavior is most likely indicates flight of ideas. So option 4 is the correct answer. Next question. A young lady presents with the repeated episodes of excessive eating followed by purging by use of laxatives. What will be the diagnosis? Options are bulimia nervosa, binge eating, schizophrenia, or option 4 anorexia nervosa. When a young lady presents with a repeated episode of excessive eating followed by purging by use of laxative, it is a unique sign of bulimia nervosa. So option 1 is the correct answer. Question number 17. Which of the following actions should the nurse take first following a violent episode on a psychiatric unit? Options are conduct a staff briefing, contact hospital administration, discuss the incident with others, or option 4 call hospital security. After a violent episode on a psychiatric nurse, the first action for a nurse is to call hospital security. Here option 4 is the correct answer. Question number 18. A client continually talks about delusional material. It would be most therapeutic for the nurse to. Options are ask the client to explain the delusion. Option 2. Allow the client to maintain the delusion. Option 3. Encourage the client to focus on reality issues. Or option 4. Explain to the clients why the thoughts are not true. When a client is having a delusional material, the most therapeutic activity for the nurse is to encourage the client to focus on reality issues. All other options should not be done by a nurse in this situation. So here option 3 is the correct answer. Question number 19. A patient going to temple gets irresistible sense of ideas to abuse God, which cannot be resisted. For this situation, the likely diagnosis is option 1 obsessive compulsive disorder, option 2 mania, option 3 schizophrenia, or option 4 delusion. A irresistible sense of ideas to abuse God while going to a temple and which cannot be resisted, it is a typical sign of obsessive compulsive disorder. So here option 1 obsessive compulsive disorder is likely would be the diagnosis. The last question of this quiz session is, which sign would a male client exhibit during socialization with schizotypal personality disorder? Options are aggressive behavior, paranoid thoughts, independence need, or emotional affect. In schizotypal personality disorder, there is a deficit in the social and interpersonal skills highlighted by a reduced ability to form a close relationship, and the person will have a paranoid behavior. So during socialization with schizotypal personality disorder, the patient will shows up paranoid thoughts. Here option 2 is the correct answer. Let me know how much you have scored from this video, and also mention me in the comment the topic on which you want more MCQs and explanations. See you soon in my next nursing quiz session.